Good morning. It's Dr. Badia with another biweekly episode of Fixing Healthcare from the Trenches. And today we are definitely in the trenches for those of us who are loyal followers, and we're here live at 9. I apologize. This is the problem with the trenches, and it leads into our healthcare discussion with Mr. Robert Aprill, who's on the business side trying to help fix healthcare. In my case, I had you can see a lot of plates and some pins and screws, and this guy shattered his wrist in a work injury, and that takes priority. And perhaps that's one of the challenges we're having in fixing healthcare, is because those of us who are actually delivering it are busy, and our priority must be taking care of patients. So we have to figure out a way that we can do that, but still deliver it in a cost efficient, humane, and streamlined manner. And for that reason, we have Mr. Robert Aprill, who's with a physician management and basically a company that helps put physicians together and make their businesses more streamlined. So without further ado, Robert, thanks for joining us, and tell us about your firm.
Yeah, absolutely. No, appreciate you having us. So our firm at Physician Growth Partners is focused on helping independent physician practices across medicine. So think single specialties primarily, but a little bit in primary care, multi-specialty, navigate the changing world of independent practice medicine. We primarily focus on advising our clients through transactions with private equity and national MSOs. But a lot of what we do is really focused on kind of achieving and maintaining independent medicine and helping physicians that chose that life of autonomy and chose that life of independence versus joining health systems and any other academia, really maintaining that and the understanding that medicine is harder. It's harder to practice medicine tomorrow than it is today, than it was yesterday.
Yeah.
And the cost to practice medicine is going to be greater tomorrow than it was today, and it was yesterday. So happy to be here. When we think about what our shop does, it's really become an extension of the leadership teams at our clients, which are independent physician practices, and help them navigate kind of the wave of private equity investment happening within the space, and really set practices up to continue to be independent moving forward and positioned to be as successful or more successful in the next 10 to 15 years as they are today.
So what would you say to those physicians who are forward thinking, who maybe aren't big? Because what I've noticed, call me naive, but I always thought, you should buy low, sell high, right?
Mm-hmm.
And obviously you folks are in this also to make a good living, hopefully, right? And at the same time, help us physicians. So how would you answer the fact that what I've noticed in healthcare is that the big players, the big groups, the big networks get more attention to just get bigger? And I understand maybe, okay, they've been proven, but what about those people who are actually doing something a bit different in healthcare that are making it more streamlined, more cost effective, but yet they're not at this level? Why is it that you don't think that those people, other than, of course, venture capital, early stage, but I'm talking about companies like yours that aren't venture capital, you understand healthcare. Why is it that you think the smaller entities get much less attention? What are your thoughts on that?
Well, look, I think it's interesting where you find it. We're at an interesting point within healthcare today where there's really, we kind of think about it as a triangle, right? You've got three different forces kind of pulling in different directions, and you can kind of argue maybe there's a fourth with the academic side of the world. But for the sake of the argument, there's three forces, and then there's independent physicians that are kind of standing in the middle of it, trying to decide their destiny. You've got health systems, which have obviously always existed within healthcare, but because of the cost of medicine, you're seeing health systems and markets consolidate, which is good for health systems, but is it good for the physician? That's a whole different discussion. Right. And then on the other side of the triangle, you've got payers that traditionally sat on the payer side, but today, they've got this kind of quote unquote wall between their provider side. But the fact is, payers like Optum and United are consolidating the provider universe as well. And one of the largest employers of physicians in the country is Optum, who's a payer, right? It's not the health systems. And then you've got private equity on the other side, right? And you've got private equity offering certain things that we can certainly talk about, kind of offering something different that's ownership and that's partnership and it's physician driven and independent, et cetera. And that's kind of on the other side. And then you've got kind of smaller groups that are in the middle trying to figure out, hey, can I exist as I always have kind of in this middle, or do I have to start thinking about what's the option for me around kind of bigger? And so to your point, and why I bring that up is you think about the kind of the size. Private equity is a small fish, and start to compare it against payers and health systems, right? And so while, to your point around attention, I actually would say that those smaller practices that want to maintain autonomy and be independent have never gotten more attention because of the opportunity that they have to partner with private equity or merge with other practices and things that can kind of combat the mega payers and health systems of the world.
I see. Yeah. No, thank you for answering my question. I'm just kind of thinking that these pressures of one needing to consolidate are, to me, in a sense, stifling innovation, because what people are worried about was being able to cover their bottom line. And to do that, you have to group together. But in order to practice medicine a bit differently, maybe more efficiently, that kind of gets lost in this equation. And that's kind of what I'm worried about with the future. Yeah. I mean, obviously, there's a lot of concern amongst physicians about the entry of private equity, because private equity companies notoriously make a lot of money. I mean, they're the ones, these guys are the ones buying houses on the water. I bought mine, but in 1999, I could not, as a busy surgeon doing this kind of work, I could not afford a house on the water in Miami at this time of day. So I don't mind. I'm a capitalist, man. I was born in Cuba. I came to this country, God bless America, but I'm worried that the people who spent all those years with education and training are gradually getting left by the wayside economically to a point degree. So I think that maybe physician growth partners may have a niche and an opportunity to really pay attention to those physicians who are doing that, rather than just focusing on the consolidation and that immediate big deal. I think that the growth down the road is really the big enchilada, but it remains to be seen.
And that's the crux of what we do here, right? Is private equity has been within healthcare for 30 years. You're going back to dentistry, anesthesia, radiology, and those groups, to your point, private equity did very well, right? They have a long track record of growing healthcare businesses. The problem with those, what we call private equity 1.0, is the majority of that return and that capital went back to the private equity group. It didn't go to the physicians. It didn't go to the dentist, the anesthesiologist. And so, what we've been on the forefront of within, really private equity 2.0 and 3.0 and, whatever fancy names you want to give it, but really the transactions that are happening within orthopedics and procedure-based businesses where you have highly producing surgeons that are leading and running these organizations, is how do you create alignment in the structure of these transactions so that it's not the overwhelming majority of the economics going to the private equity guys and the guys in suits. The overwhelming majority is actually going to the surgeons, right? The private equity groups, and we've created this alignment where there's no winning on the private equity side without the physicians winning, more so. So every dollar of incremental growth, the majority of that goes to physicians. And that creates a more sustainable model. That creates an opportunity where you create retention for physicians because they're on the forefront of that and they benefit in a greater capacity than private equity. And so, again, a much longer discussion, but one where the focus on the shift of the models today in orthopedics and gastro and neuro, and again, all the surgical specialties has been really creating true alignment so that it's not the private equity guy with the house on the water. When that platform does well, you and the physician and the private equity,
both of us do that, right? But
exactly, both.
So you guys are not. You guys connect. It may not be private equity. There may be other ways to either consolidate or grow. But you folks really are kind of the agent for, let's say, the NFL player. You guys are the agent, and the private equity or the big healthcare systems or even the payers may be the teams and the TV networks, but you guys are like the agents. So are you injecting money yourselves as a group? No, you're doing okay. So you guys obviously make your money in commission based, depending on the deal, et cetera, right?
Yeah. So so if you're a practice that's kind of considering what you want to do in the future, you go out and you hire a transaction advisor like us, and you hire a lawyer, and we're both, your professional representatives to a process. We focus really on structure, economics, strategy, and kind of general kind of quarterbacking the process. We work alongside the lawyers that obviously make sure things are papered appropriately. But that's our role, is to make sure, a big piece of what we do is making sure that transactions are structured in a physician advantageous way, right? So that the practice, it's not a one-time buyout. It's not a sell your soul to the devil, you get a big check, and then in 5 years you regret it, right? It's how do you make sure the transaction is structured so that you maintain that autonomy, that decision-making around your local practice, that you have shared upside in whatever the result of that partnership is, both economically, from an equity perspective, decision-making perspective. So, we really sit on this side of the table, the physician, and make sure that, the platforms that are created today and the private equity investments that are done today are not a recreation of the dental investments in the 90s, right? It's making sure the physicians have the biggest seat at the table when these partnerships are formed.
So yeah, you guys essentially are hopefully in the trenches with us, and it'll be a different model. So that's why we wanted you on here, because in the end, I mean, we see healthcare is changing. We can't keep our head in the sand. So no, I appreciate that. So I'd like to know it very succinctly. I mean, literally bullet points: 1, 2, 3. What do you think would be 3 great initiatives that could actually disrupt healthcare delivery, make it more cost effective, more efficient? Because what we have now is not sustainable. So, I mean, there could be 20 initiatives, but what would you say are your top 3?
I think I'm biased because everything I do is a huge. No, but I'm biased in the fact that I work with independent physicians every single day. I've never worked with or for a physician that works at a hospital system, that works in an academic setting. So the continued insulation of independent medicine is key. Hospitals are not efficient. Everyone knows that works within healthcare. And a focus on how do we create an ecosystem where a physician can be an independent medicine in 10, 15 years is key to me. So it's not necessarily a change as much as it's hey, medicine's going this way. We need to make sure we kind of stay on the same path that we have been.
Right, the course. Gotcha. Okay, number 2.
To me, that is immensely important, right? And my other 2 changes really kind of are reflective of that. Is there needs to continue to be a shift to outpatient care. And it's something we've heard about for 10 years, right? The ambulatory surgery centers, and in your world, right, doing more total joints and things, robust procedures within a surgery center setting. But more so than that, right? The ability for independent physicians to continue to control the continuum of care outside of the hospital system. It's better for patients. It's better for providers. It's cheaper. It's more efficient. And so, again, it's just it goes with the consolidation. 20 independent physicians that have joined together can support more of that outpatient care and that ecosystem outside, whether it's having MRIs, X-rays, in your world, physical therapy centers, and things that allow for you to create that patient experience within your own house and not have to rely on, big medicine and healthcare, in health systems or payers, et cetera, is immensely important, I think, in healthcare moving forward. And the last one is data. And this one's a little bit different, but it's data on this. Again, everything I talk about is independent medicine and physician autonomy. It's the ability to have data within independent settings, because that's going to assist when you eventually get to bundled payments, right? I'm sure, again, within orthopedics, bundled payments is relevant. And then when you start to get into value-based care and other specialties, the ability to show outcomes data and do that, again, not having to go to the health system to do that or go to the Optums of the world to do that, be able to have sophistication within private practice to produce the data necessary that's going to allow you to be competitive moving forward is key. And the only way physicians are going to be able to do that is by coming together and being thoughtful on how you're tracking that data, because it's going to be exceptionally powerful in kind of maintaining those first 2 points that I said moving forward.
So if I can interject regarding that, just in December, legislation was passed that would allow uh, practice-based outcomes that are not necessarily evidence-based, but
Yep.
in other words, we'll be able to use that as to hold up for particular implants. So it's something I'm very involved in. So that's great that we're aligned. So I'm going to give you my three super fast because I have patients lined up, and
Yeah.
you've been very patient. So mine is somewhat aligned with yours. One is you need to see the right clinician at the right time, and I believe totally in these outpatient centers. But as a hand surgeon, I can tell you the average person has seen two. If it's a work comp, a work injury, they've seen two or three clinicians before me. That's an incredible waste of time and money. So right clinician at the right time, that will save money, and it's good for the patient, good for the system. Second one is we need oversight, but not authorization. Authorization is literally hurdles that all clinicians must jump through, which is absurd. By people who give that number don't know about this clinical entity, and that is wasting a lot of money. Although we do need oversight because there are some bad players, or we make mistakes. We're human, and we need the oversight, but definitely not the authorization. And then the last one is what we're doing here, Robert, is patient and public education. Okay, public education will force the leadership in this country to understand that patients are sick and tired of how complex it is to access care and how darn expensive it is. So hopefully with partners such as your firm and others out there, we can really make it more cost effective. And I think we're on the right track. Certainly the authorization is something that's now being paid attention to. In fact, by United Healthcare is one of the players that you mentioned. So hopefully that'll continue. So you got the last word.
No, that I appreciate the time here and appreciate us chatting, because I think a big piece of moving forward is physicians educating themselves, right? Not every option may be the right one for you,
Yes.
but I think taking it upon yourself and taking the onus on yourself to educate yourself on these things happening in your specialty and broadly within healthcare is going to be key for physicians, and not relying on the rumor mill.
Absolutely. So our next episode will be in 2 weeks. We'll go back to having a forward-thinking clinician, a fellow hand surgeon who's been invited, who's a forward-thinking person, and hope all of you join us for the next episode of Fixing Healthcare from the Trenches. Have a great day.
Thanks, everyone.